Greetings and welcome back to CAREERMAS Day 3. Today we are talking about becoming a practice manager. And if this is your first time tuning into the channel, welcome. My name is Dr. Orobosa and I show current and aspiring healthcare management, administration, and public health professionals how to, one, quickly and successfully earn their degrees, and two, how to start, build, and enjoy profitable careers within the business side of the healthcare industry. So make sure to subscribe and turn on your post notifications. I promise you don't want to miss out. So, as I stated, today's conversation is all about practice management and becoming a practice manager. And this is a role that I know like the back of my hand because this is how I started my career as a healthcare administrator. However, before I jump into the conversation for today, here's a few words from our sponsor. Greetings, House Scholars. Today's episode is sponsored by my course, which is titled From Healthcare Graduate to Hired. Are you a professional looking to work in the healthcare industry? Or are you a current healthcare professional looking to pivot into a different sector of the healthcare industry? If you answered yes to one of the two questions I just asked, guess what? This course is right for you. In the For Healthcare Graduate to Hire course, it is a 90-minute video program. So yes, I kept it short and sweet, but I've loaded it with a lot of information, including give you a detailed strategy, as well as actionable steps for implementation that will help you go from healthcare graduate to job seeker to hired. In addition, I'm sharing my experiences of working in various healthcare positions, as well as the strategies I have given over 100 plus professionals that have helped them land their first, next, or even dream healthcare job. Now, what can you expect inside of this course? We're going to talk about everything from preparing your job hunting strategy down to finding the right healthcare job for you. In addition, I'm giving away a few course bonuses, which includes access to an exclusive recruiter directory. So we're giving you the name and contact information to healthcare recruiters who you can work with to help land your next healthcare job. In addition, you're going to get access to the For Health Scholars job board, as well as a live Q&A session with me, Dr. Orobosa, to answer any questions you may have. So I hope this sounds good to you. And if you are a job seeker who's been applying to 6 months without any response, guess what? This course is right for you. To sign up, you can access the link in the description box. And if you have questions, you can also contact me at forhealthscholars@gmail.com. I hope this is helpful, and I look forward to seeing you in the course. Right, so we are back. And as I stated, today's conversation is all about practice management. Like I said, this is a role that I know like the back of my hand. This is how I started my healthcare management career. When my first job in healthcare management was being a practice manager for a private practice, and I managed two of their facilities. So I managed the facility that they had in Midtown Manhattan, and also managed a facility that they had in Parkchester, the Bronx. And so, I worked in that role for like 6 years. And so I'm going to give you all that I know about this role. And I'm not saying that it is a role that you should choose, but it is an option if you are a healthcare management or administrative professional. Now, in the practice management position, it is all about leadership. And as Warren Bennis stated, leadership is the capacity to translate vision into reality. And truly, as a practice manager, you're taking the vision, mission, and values of that organization, and then you're turning that into reality. How do you move this organization forward? How do we see patients? How do we keep providers happy? How do you hire staff? And the role goes on and on, but let's get into it. So if you're not sure what practice management is, a practice manager is an individual who oversees the business and the clinical operations within a medical office. Okay, so your role, it is multifaceted and it requires you to have so many skills, but I truly enjoy it. And sometimes I miss being a practice manager, and other days I'm like, okay, we're moving forward. And I prefer to be an educator. But in that time, when I was younger, I had the strength, the ability to really lead organizations forward. And I will say I did a good job. And so as a practice manager, it's all about knowing your organization inside and out. So as practice managers, you help medical offices implement their vision to achieve success. And so as a practice manager, here's your areas of focus in your role. So customer service is definitely a part of your job. Front desk operations is a part of your job. And I will here to tell you that sometimes when my front desk staff called out because or they took time off and we didn't have any type of replacement, I would have to work as the front desk individual, um, booking calls, taking patients, running insurance. And so the role keeps you on your toes. And then also, you may be responsible for community outreach, marketing, human resources, clinical operations, vendor relationships, and health information technology. Now, as a practice manager, you need to have great organizational management, leadership, and customer service skills. That is the top three things to have. You need to be able to lead the organization. You need to be able to lead the people within the organization. You have to be a leader. All right. So sometimes operating from a space of just a manager doesn't cut it. You have to lead the organization or the staff that is working forward. And then customer service. So there's plenty of times that I had to deal with patients and their complaints or the things that they loved about the facility. But if you're like a person who like, I'm great with people, I'm a great leader, and I have great organizational management skills, then this role may be right for you. Here are some of the different job positions you may see, but they all mean practice management, right? So if you're looking for a practice management job, you're like, what are the different titles? Well, here are some. Some organizations may call their practice management role as an office manager. Others will say clinical manager. Others may say practice administrator, clinical supervisor, clinic director, practice manager, operations manager, or even physician practice manager. So when we say physician practice management, it is on the outpatient side. So usually you have a physician who opens their own private practice, or physicians, they've come together to open their own private practice, and they need a practice manager to help them with the business operations and the clinical operations and the marketing and the human resource operations in order for the clinic to run smoothly and efficiently. But the common term that is used to describe this role is practice manager. So you may find that many job descriptions, if you're looking for employment right now, or if you are working as a practice manager, you may hear them reference you as a practice manager or office manager. That's another term that they use. But practice manager is more common. So if you're looking for jobs, that is, and you want to be in the practice management arena, those are the different keywords that you will use to find organizations that are wanting to hire a practice manager. Now, what is the job description of a practice manager? Well, I looked at a few job descriptions, and here were two summaries that I found that just kind of summarize what they're looking for in a practice manager. So a practice manager, a health office manager, they're responsible for overseeing the administrative and business operations aspects of a private medical or wellness practice. And so you may see mostly this position being offered by outpatient facilities, but some inpatient facilities also hire practice managers, because if you are working for an organization that is a part of a larger system, and I'll give you an example. In New York, you have New York Presbyterian. New York Presbyterian is a large healthcare system. And under this system, they have the hospital, of course, but they also have private outpatient practices that they bought. And this is what really kind of closed down my side hustle, which was the first side hustle that I had, which was helping private practice managers be able to open their own practice. Because of the expensive cost of running a private practice, many physicians was saying like, hey, you know what, I'm going to just partner with the largest system who covers all of the expenses as far as like facility costs, electricity, and supply. I'm going to, partner with them, and they're going to buy me out. And instead of having it as my own private practice, I'm working in the outpatient side for a practice that is now a part of this larger system, like New York Presbyterian. Montefiore was another one in New York. Mount Sinai system was another one. So, just good information to know is large healthcare systems do buy out private practices. And as a result, they put them a part of their network, but they still may need a practice manager to help them manage the operations of that given facility. Also, their duties include hiring employees, so the human resource aspects of it, ensuring compliance and regulation, managing the budget of the practice. Okay. And I really love being a practice manager during the time that I was a practice manager, because it taught me so many skills that I now use to teach my students in the classroom as a professor. It gave me the real world practice experience that you can't find in a textbook. So keep that in mind. It is a position that allows you the flexibility, but it's going to teach you so much about the healthcare industry. Then, what are the qualifications that are required of a practice manager? So, of course, as a practice manager, they want you to have some education. Some practice management positions will allow you to have at least an associate's degree now to work in the positions. Others may want you to have a minimum a bachelor's degree. So keep that in mind. With the practice management position, it allows for entry level healthcare administrators or managers to work in the role. They hire you because you can get your start here. And that's where I got my start in practice management. And I loved it. I spent about 10 years as a practice manager, and it allowed me to go to school. It allowed me to really solidify my decision of I really wanted to work in the business side of healthcare because of the dynamic experiences that I was having working in various clinics as a practice manager. So having that formalized education at minimum, a bachelor's, some positions will allow you associate's degree. At the master's level, they may hire you, but from what I have seen, usually as a practice manager, you're getting your master's in that role, and then you probably move on or you get promoted up to being like a center director if this is on the outpatient side, or to be in some type of directorial position in healthcare when it comes to management. So just kind of giving you the usually the pathway that a practice manager takes when they're working in this role. It's like a starting point for many, including myself. Then, as a practice manager, you must be abreast of policies and best practices for running a clinic. And you're getting your bachelor's degree, depending on your curriculum, they teach you this. So you get exposure to accounting for non-accounting managers in your bachelor's degree program, even master's degree program, but more so bachelor's. You get exposed to policies, performance improvement courses, quality improvement courses. So as if you are a bachelor's student in healthcare administration, or you have a bachelor's in health administration and you're still looking for a role to work in, practice management may be right for you. Even in your bachelor's degree program, they may give you courses like billing and coding. And take those courses seriously. I'm not just saying this as a professor, because what you learn in the classroom definitely will be implemented in the real world, or in the field, as we would say. So I always tell my students, like, this is a industry that what you learn in the classroom is not like you're not going to see it again. Actually, you may see it again amplified in so many different ways. So keep note of that. But they want you to have billing and coding experience, being able to interact with patients. So customer relations, problem solving, and patients, they're going to tell you how they feel straight up. Okay. I'm just going to warn you. So if you're not a person who is people friendly, or be able to just multitask and manage people, then this is not a role for you. You have to be able to manage people and everything that comes with people, their emotions, their moods, of course, in the legal and most professional way. But in this role, with patients especially, they're going to tell you how they feel, what they want. Now, sometimes you cannot give them what they want, but you can at least hear their concerns. Now, what is the typical salary of a practice manager? So, this varies from state to state and organization, but according to payscale.com, on average, a practice manager gets paid about $64,000. Now, let me tell you, when I was hired as a practice manager, my salary was like $40,000 annually, and it was my first position. So I think I did I have a job before that? No. I had just came back from Nigeria. So I had lived in Nigeria for a year, and I was really like, okay, I need to go finish school now, and I need to get my degree. And, was offered this opportunity. So I actually became a practice manager before graduating with my bachelor's. And, when I got my master's, or when I was doing my master's, I worked at another organization. So, um, I started at 40,000. The fact that they're paying 64,000 is so much better, because it is a lot of work. And if you have less than a year of experience, about 52,000. If you have about 20 plus years of experience, about 69,000 is the average. Now, if you watch my negotiation video, I taught you how to negotiate effectively based on my own experiences and what I know has worked by sharing it with others. So check that video out. You're like, okay, 54 is a little low. How do I negotiate up? That video may help you. Okay, so now what are the type of healthcare organizations that hire practice managers? So hospitals, if they have outpatient facilities, or that is usually where you see them hire practice managers. Outpatient clinics definitely hire practice managers. Nursing homes to a certain extent, so they may call it a different name, but in the nursing home you may be responsible with helping with the admissions or depending on what part of the nursing home. So some nursing homes have assisted living, independent living. You may have to manage that and they may call that title something different than a practice manager, but you may be an office manager. That's the better term. And so in a nursing home, they may ask for office managers. Traveling practices, they may ask for office managers. Integrative and functional practices, so your holistic practices, they need office managers, aka practice managers. Dental and other specialty practices or clinics, they would need office managers because once again, you are overseeing all of the operations, whether it is clinical or administrative of that facility. And it doesn't mean that you're actually triaging patients. You're not doing that. That's not out of the scope of your practice, but you are working with providers to make sure that they bill accordingly, that they have the supplies that they need, that they are exercising best medical practice and ethics when they're doing their job. I had to fire a couple of providers before because they wanted to do their own thing, and that goes against company policy. So a human resource aspect of it, depending on your organization, you may be responsible for that. I used to have to hire people as much as I used to have to fire people. So if this sounds like a role for you, then I would definitely encourage you to go for it and just ask yourself the question first: is practice management right for me? And if you watch this video and you're like, yeah, this sounds like something I can do, and I would definitely tell you go for it. All right, so I hope this was helpful to you. Thank you for joining me in day 3 of CareerMass. And until the next video, make sure to like, subscribe, and share. Bye for now.